Good morning, everyone. We'll be getting started in just a few seconds and a few minutes. We're going to let everybody trickle in. We're so excited to have you with us today. Good morning. Good morning.
Good morning.
Hi, Miss Annie. How are you this morning?
Fine. How are you?
I'm doing all right.
That's
Glad to have you with us.
Thank you for having me.
Well, I think we'll get started and we'll just let people trickle in as they can. Good morning and welcome. We are so excited to have y'all with us today. My name is Elizabeth Brewington. I am the Associate Director for Partners in Health and Wholeness, focusing on overdose response. For those of you who are new to us, Partners in Health and Wholeness is an initiative of the North Carolina Council of Churches. It has been around for the past 11 years, connecting faith communities around the issues of health and faith. We have several key cornerstones such as healthy eating, active living, smoking cessation, healthy aging, and obviously overdose response. About 5 or 6 years ago, we were hearing from faith communities that overdose and substance use was a real issue in our congregations. And so we launched our program 4 years ago to educate churches around the issues of overdose and harm reduction and connect them to resources in their local communities through our Clergy Breakfast initiative. Obviously, with the pandemic, we've had to move to Zoom. And in recent years, we've had the opioid settlement come up as a big topic. And so we are so excited to have Steve Mange and Amy Basin here today to talk to us about it. So as you all know, the opioid settlement will be coming to North Carolina very soon, and each of our counties and cities will be getting some funds as part of this settlement. And so we really wanted to educate our health leads, our clergy members, and kind of interested faith community members for how they can advocate for the best use of these funds. And with that, I'm going to turn it over to Steve Mange, the Senior Policy and Strategic Counsel for the North Carolina Department of Justice, and Amy Basin with the North Carolina County Commissioners Association to talk to us about the settlement and ways we can get involved.
Wonderful. Thank you so much. Very, very excited to be here. Very grateful for all of the work that you are doing in communities across the state. I know this has been particularly with COVID, a very difficult and challenging time. And we're hopeful that, among other things, maybe some of these opioid settlement funds will help you and other partners in your communities address some of the challenges that you're facing. And so Amy and I worked very closely together with our respective organizations to hammer out a deal on how the opioid settlements were going to play out in North Carolina. And we have also had the pleasure of doing a lot of tag teaming on these presentations. And so we're going to kind of keep it interesting for y'all so you don't have to listen to any one of us for too long. We're going to kind of volley the ball back and forth. And I'm going to just start by telling you what we hope to cover today. And that is just a little bit about the national opioid litigation that you probably read a lot about in the paper, but that is frankly pretty confusing even to those of us who are involved in it. And then talk about what we're calling the State Memorandum of Agreement, or MOA, and then try to leave a lot of time for you to ask us questions. Sometimes a lot of the discussion around the opioid epidemic starts with a comparison to the Tobacco Master Settlement. And one of the noteworthy features of the Tobacco Master Settlement is that a lot of the money, I'm sure you've heard, did not go to addressing sort of health-related issues. And so with the tobacco settlement, less than 3% of the money went to really address health issues around tobacco. And the good news is, by contrast, that the opioid money is really destined to be spent on strategies to address the opioid epidemic. But interestingly, the tobacco litigation, as big as it was kind of simple in terms of the parties. It was a bunch of states against 4 tobacco companies, whereas the opioid litigation is much more complicated. There's not just states, but counties, cities, health systems, and others. And then there's a whole bunch of different defendants that include drug makers, drug distributors, as well as chain pharmacies. And so these are those groups I just mentioned across the top of this. And by the way, we're going to provide these slides to you, so don't feel like you need to furiously write down everything that we say. Across the top, you have drug makers like Purdue Pharma, particularly, that makes OxyContin. Then you've got drug distributors that are these companies that basically get the drugs from the drug manufacturers and they send them to pharmacies all over the country, on every single main street and every single city and town in the United States. And then there's also pharmacy chains that have been sued as part of the litigation. In this first row that you see where it says filed for bankruptcy, this is those companies that, largely because of all of this litigation, these thousands of lawsuits, have ended up filing for bankruptcy, especially Purdue Pharma. And in this middle row is really the topic of today's presentation. This middle row is a group of companies, the big 3 drug distributors, plus the drug maker Johnson & Johnson, that are part of a $26 billion nationwide settlement that is really what we're talking about here today. But the bottom row, the point of the bottom row is that there are still companies that haven't filed for bankruptcy and aren't part of the national settlement that are still engaged in litigation or settlement talks. And some of those are drug makers and some of those are drug pharmacies. So now I'm going to talk about this middle row, this $26 billion settlement. And maybe at this point, you're probably already getting sick of me. And so I'll probably turn it over to Amy and let her cover a few slides.
Thanks, Steve. No, Steve does such a great job and has just been so integral to this process. So if I might just, I'm going to go off, Steve might worry here when I say I'm going to go off script here slightly for a moment, but I guess take like a little point of personal privilege to say how appreciative we are of the work that you all do. And before we got on, I was just looking at some of the work that you've done in this space. And I mean, we always come back to, we, Steve and I in particular, with the groups that we've worked on, we have gotten very into the weeds of the legal and the technical. And that's a lot of what we're talking to you about today, right? Because that's how this money is coming in. But we always try to go back to the why of why we're doing this. And that's what we are so just impressed and appreciative of, the work that you're doing in this space and with the folks who really need this help. So I think one of the things that, in looking at, as I'm going to get to a little discussion on how this money from these national settlements is going to flow in, I think one of the things that, if I can speak for both of my organization, we represent all counties and county commissioners across the state, and then Steve with Department of Justice. I think really the sort of fundamental level set question at the outset, and I know this was very critical to the AG and to our folks as well, that this money needs to go to where it is going to be helpful, right? This money needs to go boots on the ground to places where we're going to see real impact and real change and be efficient and effective in as much as possible. And so that is how we got to this construct of how the money is going to flow into North Carolina. So as Steve explained, there was a move afoot to hold, what's different about this type of epidemic, as you all know, with all the work that you've done, and it is, there's so much that is really truly tied to these companies that brought this into the fold, right? And so in the settlement that is coming out, this $26 billion over 18 years that will come into the entire nation, to hold these companies accountable, and then get that money out to try to address some of the harm that was done, right? So again, at that level, at that national level, there is this $26 billion settlement, but then each state stands to get a certain amount of money. And that's where we came in North Carolina to say, how can we make the most of the money that's coming in, which is approximately about $750 million over 18 years. The reason we say approximately is it's based on formulas on the national level that have to do with opioid impact, harm, and that it has yet to flow into the state. Our hope is that it will begin flowing sometime in the spring to early summer. And the work that we have done, and we're going to get a little bit into the details more here, is how can it be most impactful in its allocation in North Carolina. So I think, do we have, what's on our next slide? It may talk a little bit more about.
Did you talk about the 26 billion and the 750 million?
I did.
Sorry.
And we'll go to the next. So
Great.
if we can look at the,
Back.
yes. So, right. So to Steve's point, right. So that is you got the national settlement amount and then the amount coming into North Carolina. But then at that point, how does those monies within North Carolina, how did those get allocated? And there was sort of what was called a sort of a default mechanism up front, in which 15% of those monies coming in originally would have gone to local governments, 15% would have gone to the state, and then there would have been this big kind of abatement fund that we heard loud and clear from a lot of parties, especially as you heard Steve refer to the tobacco litigation. There was concern that was going to get caught up in bureaucracy of some big bureaucratic fund that we had to figure out how to distribute. And so instead, the way it is structured here in North Carolina through this Memorandum of Agreement is that 15% of the total funds will go to the state, to the General Assembly, that they will appropriate for opioid harm reduction and to address these problems that we're seeing. And then the remaining 85% will all go directly to local governments. And what that means that all 100 counties will get an allocation from the settlement of 85% of the settlement, and then 17 municipalities. The reason for that number of municipalities is that there was a population threshold of 75,000 or above, and there were several municipalities that also filed suit. So those will get the direct allocations in addition to all 100 counties, with the caveat that there is strong incentive and desire and work to regionalize, collaborate, to work together, because there's a real recognition, right, that this is not something that stops at any city border, at any county border, and we're all working together trying to get best practices and discuss how this money can be used in a collaborative manner. And so that is how the money will flow. And then I'm going to turn it back over to Steve now to talk a little bit about what does it mean as to how the money that's going to come in can be used.
Thank you so much, Amy. So as part of our Memorandum of Agreement, we talked, as Amy said, not just about where the money goes, but how should the money be spent. And, you know, after really like many months of discussion and negotiation, where we landed was that local governments basically have two options. They have option A, which is a short list of very evidence-based, sort of high impact strategies, things like medication-assisted treatment, recovery support, naloxone, syringe service programs, and other strategies that I know that the Council of Churches has been very involved in exploring. And then option B is for counties that may wish to explore a wider range of strategies, they kind of go through a strategic planning process and then have access to strategies. They could still go through this process and pick one of the option A strategies, or they could pick from a somewhat wider range of strategies that's included in the national settlement. And here's a little bit more detail on those option A strategies, because I know this is an area where Partners in Health and Wholeness has really done a lot of work in exploring and educating and discussing these strategies. So you can engage in planning, you can provide evidence-based treatment, various kinds of recovery support, various harm reduction strategies, including naloxone and syringe service programs, as well as those critical strategies to help folks who are enmeshed in some way or other with the criminal justice system. Another thing, let's see, Amy, is this your slide or my slide? I've forgotten.
You're doing great, Steve. I say you keep going.
All right, I'll do this one, then I'll give it back to you.
Totally.
one of the things we're really proud of with our MOA, and I think we really lead the nation in this respect, is a really high level of transparency and accountability. So really everybody's going to know how the money is getting spent. And that is going to be because this information will get reported and it will go up on a statewide opioid dashboard. And so before the fact, really essentially what we're saying here is that counties and municipalities need to be very transparent about any plans that they make to spend the money. And that will be on the dashboard, as well as every year there'll be a financial report and an impact report describing how the money was spent and what kind of impact it had. And now I will turn it back to Amy. Amy, I think you're on mute.
Yep.
Oh, there you go.
I was having trouble unmuting, but there we go. Thank you. Yeah, and I went ahead and put a link in the chat to some resources on the NCACC website, and also the More Powerful NC, and I think it's the dashboard's on a separate link. But what you will see from the information on the Association of County Commissioners website is something that's going to talk about the settlement status. And the reason that is significant is that, first of all, it shows you the incredible work that has been done to bring all 100 counties into the mix on this, to understand the importance of this. And when I say that, it's because not every county, we had 76 counties that actually engaged in the lawsuit and the remainder did not, but all counties will receive funds from the settlement. So it's critically important that we worked together to get each county and also those 17 municipalities to essentially what's called sign off on the settlement. Because as you can imagine, that from these defendants' perspective, they're saying we're agreeing to a settlement. We are going to provide these funds that we've negotiated. However, we need to know that there's some certainty here, that then these other entities are not going to turn around and say, yeah, we don't care, we're still going to sue, right? So it was critically important that we got everyone to sign on. And by everyone signing on, that means that the monies will begin to flow here in North Carolina, in the percentages that we hope that we were, and the numbers that we hope that we were telling you. And so in addition to that, again, as I said, I popped in the chat, there's some other resources on both of those websites that will give you information specifically on what the MOA looks like. So you're able to go in and see some of those strategies and the appendix that Steve talked about, and also the transparency and accountability and some of the other things that will be required of the entities receiving the money, and also might provide, if you have any questions or concerns, you can look through that as well. Thanks, Steve.
And there again is the resources that Amy mentioned. So there is this dashboard that is going to be the place where you can find out how every county is planning to spend the money, and ultimately how every county did spend the money. And that is ncopioidsettlement.org. One thing about that dashboard is there's really two purposes to the dashboard. One is to report that information, but actually even now that dashboard, it's already up and running. And there's a lot of resources there to actually help local governments think about the best way to spend the money. A lot of resources about those option A strategies that I listed. And there's a lot of really great data up there, thanks to the Department of Health and Human Services and the UNC Injury Prevention Research Center. So you can go to your specific county, you can click on your county, and you can get information about opioid overdose deaths. You can get information about various, what we all call community drivers of health or social determinants of health, like homelessness, suicide rate, other things you might want to be looking at as you're thinking about the best way to spend the money. And then you see there the Department of Justice information on morepowerfulnc.org. And you also see the website that Amy mentioned, the county commissioners, with also a ton of great information about the settlement. So that was our presentation that we tried to keep short and sweet so that we could leave a lot of time for concerns or questions that you might have. And I don't mean to sound like your elementary school teacher, but if you have a question that you're thinking about and you're thinking, I don't want to ask that because that's probably a dumb question, you're wrong. The answer is, if you have that question, probably 5 to 10 other people have that exact same question. So I would really, really encourage you to just ask the question or put it in the chat or whatever you are most comfortable doing.
Thank you. All right. Does anybody have any questions? So I guess my first question is, how can people find out when their county commissioners or their county government are going to be talking about the settlement funds? If they wanted to listen, pay attention, find out what is being discussed, how would somebody go about that?
Happy to take that, Steve. That's excellent question. So one of the things that Steve talked about in this, the transparency and the accountability, is that in order to make sure that the funds are spent in accordance with the Memorandum of Agreement, counties will and municipalities will have to put this on an agenda, discuss it, will have to be a part of either the budgets that they adopt in terms of how they are going to spend it, or they can do individual resolutions as to how to spend the money. So with regard to like the first, I guess, tranche, or the first amount of money that's going to come in, there's the potential that they could be doing some planning right now for the budgets. They passed their budgets on a fiscal year that will start July 1. So they're in those budget talks right now. The issue, though, is that we don't know exactly when the money's going to be coming in. So what's likely happening and different counties are in different places in this process. Likely counties that are, further ahead in this process and are already doing work are probably having some strategic planning discussions and those types of things. And those, again, are going to be happening either in open session at board meetings or in work sessions. Again, that would be open. So if you have questions, and we can help you make those contacts, but I would encourage you to reach out to the counties that you're engaged with. Either you can reach out directly to your elected officials, the county manager, find out when this is planned to be discussed, if you can get copies of agenda, because again, this would all be done in open sessions. You would be privy to it. Public comment is allowed, and you could have those conversations. And of course, we always encourage, your elected officials, you can go talk with them one-on-one, have those conversations as well if you have questions. So again, we can help direct you to those folks in your counties if you have questions about that.
And Amy, when we've gotten questions like this in the past, I've heard you and Kevin mention two things that I'll ask you about. One is it helpful for folks who are active in this area? Should folks go separately, or should they try to coordinate their message? That's the first question. And the second is are there particular commissioners that tend to be better to talk to than other commissioners, or how should we be thinking about that?
Sure. Yeah, that's a great question. First of all, I think there's always benefit, unless you had, let me preface by saying, if you have a personal relationship with a particular commissioner or particular member, there's always benefit there going one-on-one. Aside from that, I think there is such benefit to collaborating a message, again, because the more that your elected officials in your counties are going to see that this is really something that is being worked on, there's already collaboration, this is happening. So I think to the extent that you can coordinate and work together to go talk with them, provide information, they are going to welcome that. And especially from organizations like you all that are already in this space, right? You're doing this work, what's working, and you can really, there are some and the counties that are already really working in some of these programs, you likely know, right? And for the ones that aren't, they want to know what is working. They want to know best practices. So I think if you can go to them collectively, collaboratively, and really bring them the message with, this is what's working evidence-based wise, right? We're not just talking about, some general ideas that we've seen it and here's what we have. So I think to the extent that you can provide them with specific detailed information, really on point message, they're they're all busy, right? They've got a million things going. This is one thing on their agenda, but it's a differing level of I don't want to say it's critically important to all, but it's a different level of interest to different. We have some commissioners who are actively engaged in the space. They have personal stories. We have others who kind of defer to the others on their board, right? So that to the extent that you can distill that message clear, and then if they have more questions, we can also help with that. And I will also tell you that we did have a number of commissioners actively engaged in this planning process. So I would encourage you to take a look on our website on some things and find out from folks that who in our communities in the elected space might have some specific background knowledge in this area. And those would always be good ones to approach. Did that address those?
Yeah, definitely. And on that score, one thing I've heard, which was such a great practical tip, is you might take a look at your LME MCO board. These are the regional, or some of you know this, but these are the regional organizations that are involved in providing behavioral health services. These are multi-county organizations. And one really good way to figure out which county commissioner is really that county commissioner who's attuned to sort of, behavioral health issues is figure out which one from your county is on the LME MCO board. That's a pretty good indicator, a pretty good practical strategy.
Yeah, that's a great point, Stephen. And I will just, put a final point on all of this too, is that to the point, I think that, again, with all the work and knowledge and background and understanding that you have in this space, I would highly encourage you to do that. Go to those folks and say, we are here as a resource, because in the counties, again, that are really in this space, they'll say, great, let's work and collaborate. But there are a lot of counties that are just kind of wrapping their heads around how they can be most effective. They're getting ready to see this money come in, and they want to be smart. They want to strategically plan and use it effectively. So if you can go and offer guidance and resources in terms of what's really working, I think that would be welcome.
Hey, this is Caroline. I had a quick question. You had mentioned that you were doing the presentations other places. I work with a ministry in the western part of the state. So have you had it there, or is that schedule posted someplace so I could point some people to it?
Great question. I can tell you that in the western part of the state, particularly the 18 westernmost counties, we are very, very fortunate to have a high level of interest and involvement from the Dogwood Health Trust. And so there have been some meetings, a combination of Dogwood and myself and Amy and some of Amy's colleagues from the North Carolina Association of County Commissioners, and some of the commissioners out there, particularly Burke County Commissioner Johnny Carswell and Buncombe County Commissioner Jasmine Beach Ferrara, both of whom have a real personal stake in this. So there have been a series of meetings. There will be more meetings because a lot of the counties are getting funding from Dogwood to engage in planning process. Caroline, are you out there? Are you in one of those westernmost
I am
counties?
not.
Okay.
I'm in Raleigh.
Okay.
So I was a long time ago.
Absolutely. And so there is a lot of ferment around, a lot of discussion out west, particularly on these issues, thanks to the Dogwood Health Trust.
All right. Thank you. That gives me what I need right there. And you're going to email the slides to us, right? For today?
Yeah, well, I think Elizabeth, you have them already. So please
Yes, I'll make a
feel free.
PDF of them to send out in the follow-up email and include all the links that were in the chat. I will also say we are doing an event in partnership with the Western United Methodist Conference and the Northern Piedmont District Conference to go over this settlement and go over a lot of the topics we're discussing today at the end of February. And so I'm putting the link to that registration in the chat if you would like to pass that along to other people.
Yeah, that's us. That's the North Carolina Conference.
I'm sorry.
Okay. But the Western Conference is welcome to join us.
All are welcome. We are trying to get this information out to everyone. I'm sorry I
Right.
pulled the name.
No, it's okay. Yeah, we're trying to help our congregations come up with practical things that they could do to not only advocate, but engage with their community on this stuff.
Mhm.
So Steve and Amy, do you have any kind of practical advice on how faith communities can engage in this issue or?
You know, one thing that occurs to me as we're sitting here talking together is that there are like SUD task forces and coalitions in many communities across the state. And Elizabeth, the link for that, I'm sure you could track it down and include it in your email, but there's a group called Community Impact North Carolina, CINC, and DHHS pays them to maintain a statewide database of these various SUD coalitions that tend to include a lot of the key providers and advocates and social service providers. And that might be it if your county, and most counties have these, if your county has a coalition like that, or that would be a good group to try to reach out to, so to make sure that your voice and the voice, you know, the voice of your congregations is heard as some of these discussions are going on. That's a really practical thing to do. But I would think a little bit along those lines about just reaching out to some of your natural allies on this, and that might be your health, if you have a connection to your health system, a connection to if there's if the North Carolina Harm Reduction Coalition or the Survivors Union or other sort of grassroots groups are working in your county or in neighboring counties, that would be a great reach out. And I think that I think Elizabeth could probably help you make those connections. And frankly, if you're struggling and you just can't figure out who to connect with, you know, Elizabeth, I would reach out to Elizabeth, and Elizabeth, you're always welcome to reach out to me and say, gee, we just can't figure out what's going on in the Lumberton area. Do you have any ideas? Does Amy have any ideas? I mean, I really feel like everyone on this call, that as a group, we can get you one way or the other, we can get you networked into some of these discussions.
Thanks.
And I guess if it's okay, since we have such a wealth of knowledge and resources here, I might pose a question myself, if that's okay. I would just welcome, from y'all's standpoint, and again, doing the work, boots on the ground, how can we best coordinate on our level to make sure that there is, I think one of the things we're really, wanting to make sure is that there's not so much duplication, right? That there is collaboration, and we're most effectively and efficiently using these funds to make the most impact rather than just standing up all these little individual programs. So do you have any suggestions for us on how we can work with groups such as you and other groups to try to get that collaboration facilitated?
So one thing that we heard from a lot of faith leaders when we first started doing this work is they weren't aware of what resources were available in their community when it comes to substance use. There would be knowledge of an NA or an AA, but treatment providers or harm reduction programs, because this topic is so stigmatized, there wasn't a lot of kind of knowledge about what resources were available. I know when we started doing our clergy breakfasts, we would try to pull that together into one sheet, but that was very difficult to find sometimes, depending on the area you were in. And so I think the website that Steve mentioned about all the different coalitions is a really great resource, but trying to figure out what resources are offered in which communities, to your point, so things aren't duplicated.
Yeah, and let me just pitch in actually, because DHHS just updated this really, really excellent resource. And maybe you can include that, Elizabeth. It's called North Carolina Drug User Health Resource Guide by Region. And they just literally updated it in January 2022. And it is a wealth of information. It is very much geared towards folks who are looking for different kinds of services, whether it's syringe access programs or free clinics, but I think for some of y'all, this might be, first of all, good information to get out in your communities, but also I think it may give you ideas about who to reach out to in your community. And so Elizabeth, definitely, I would definitely highlight that resource because it's really outstanding. And I think a lot of people aren't aware that it exists.
I will definitely add that. The other question that came to my mind, and I will apologize in advance, I had to do something while we got started. Did y'all touch on how this settlement funds are different than what's going on with Purdue?
Yeah, I can talk about that
I think
for
that
a
would be
minute.
helpful.
So, and I'm just going to pull this slide back up again because I think it's helpful. So you might remember at the beginning of the presentation, I talked about which companies are involved, and let's see if I can. I'm going to just leave it in this mode, but y'all can see the slide, which companies. So you'll see that the settlement here is these 4 companies in the middle, and it doesn't include that top row, companies that have filed for bankruptcy. But many of you know Purdue Pharma, they're honestly kind of like the Darth Vader of this story. They really did a lot to create and fuel the opioid epidemic by their overly aggressive marketing of OxyContin. And so because of all the litigation against Purdue Pharma, they ended up in bankruptcy court. Bankruptcy court is its own special type of proceeding that is completely different from other legal proceedings. And what happened is there was a settlement, there was a resolution of the Purdue bankruptcy that would have provided several billions of dollars on top of the settlement we're talking about today. It would have provided, I told you that there's $750 million from this settlement coming to North Carolina. It would be like another $100 million coming to North Carolina. But what happened was essentially some states appealed this resolution of the Purdue Pharma bankruptcy. And on the appeal, the court essentially overturned the resolution. And so I won't go into the legalities of it, but basically the Purdue Pharma bankruptcy resolution is kind of on hold right now. But the key thing to understand is the fact that the Purdue Pharma bankruptcy resolution is on hold has no effect of any kind on this middle row, which is the $26 billion that we've been talking about. So there's a lot of, it's a lot of legal mumbo jumbo to frankly understand, even for me, and I'm a lawyer. So there is potentially some additional funds coming from that Purdue bankruptcy, but it's on hold right now.
Yes,
Great
Steve,
question.
that was an excellent job of explaining that. It really was. And it highlights how complicated all of this is. Like, we have people who have been so involved with all of this, and we're still a little unclear on it. So what I would say is, if you have questions, reach out to us. You can hopefully have our email addresses. We're happy to answer. And you're going to continue to see things, right? So as Steve said, like the $26 billion settlement, hopefully that's locked in, that's coming. Purdue, who knows? It has the potential to bring this additional $100 million into the state, but it's in this state of flux right now. There was another settlement you may have heard about with a consulting company called McKinsey that brought some money into the state, right? That's a separate pot that went only to the state, and they are working to allocate that through the General Assembly. And there may be others out there as well. There are pharmacy suits out there. So, there's a lot kind of swirling in this space, and to say it's complicated and confusing would be a tremendous understatement.
Yeah, nobody disputes that taken as a whole, the opioid litigation is the most complicated litigation in the history of planet Earth. There's no doubt about it. There is no litigation in any country on Earth that has ever been as complicated as all of this litigation involving these opioid makers, distributors, and pharmacy chains. And just a practical note, Elizabeth, yes, please include the contact information for me and Amy in the post presentation email that you sent out, in the after action report that you send out.
Oh, yes, y'all will be getting a wealth of information afterwards, including Steve and Amy's emails for sure. Any other questions, clarifications? This is super complicated, so we'd love to clear things up.
I think it's going to be really helpful to have all these resources. Thank you so much. That's good stuff to dig into.
And
I
guess
noticed
if I-
that there's nothing in Cumberland County on that map. So that's where I live.
And what did you mean? What did you mean when you said there's nothing in Cumberland County?
Just looking on this map from the Community Impact, North Carolina,
Oh.
I don't see anything in Cumberland County.
Yeah, we might be able to help you with that.
Okay.
We could figure something out. There's definitely work going on in Cumberland County. Why don't you, Elizabeth, could you work on that with, I think collectively we could figure out some contacts for Jay to reach out to in Cumberland County. If you would, Elizabeth, if you would quarterback that.
I can do that.
I think we can figure something out.
Thank you. And, I was whining to Elizabeth earlier about the money that went to Robeson County to a church that has no experience working in any kind of substance treatment. And the building that they're in or they're proposing needs tons of work. I mean, people from our conference live down there and they know exactly what facility they're talking about. And I mean, somehow they got a hold of a bunch of state money. It just seems like a big waste. We'll see.
And so it sounds like that is not, that did not come as a result of this settlement. That's a separate pot of money.
Yeah, it came from the state budget, apparently.
There was 40 million distributed through the state budget to various different organizations that do treatment. This organization got $10 million, even though they have no history of being a treatment organization. And yes, it's
Oh, and there has been problems with misallocation of funds in the past.
That really highlights back to something we were talking about earlier, to the extent that you all have evidence-based, information, statistics that you're working on. I'm thinking like in Cumberland County, that you can go to folks there and say, hey, look, here's what's working. Here's what's, that I think on a low, at least from our standpoint, on a local level, when they see that, that's what they're looking for, because they have, with this money in particular, I mean, there are accountability measures. There are things, right? So they're going to need to be able to, on the back end, show that it's being used in the way that it's intended. We all understand in this space that, outcome measures are really difficult, right? How do you, but that there are things that they can look at that are evidence-based, and they do have parameters and metrics that they need to follow. So I think that would be, hopefully more in line with the way that these monies will have to be spent.
Yeah, and I'm just thinking now about, well, hey, Jay, we'll get back to you about Cumberland County. My wheels,
Okay.
the mental wheels are slowly kicking into gear.
Okay,
and I
great.
have somebody to connect you with, Jay, that
Okay.
works in harm reduction there.
Great.
That's what I was actually going to say. They've been active there. So yeah, great. Thanks, Elizabeth.
Great.
Any
And I
other
know
questions or connections? Sorry, Jay.
that's okay. Ken Locklear's on this call, and he lives in Robeson County. And the Native American Co-op, which is a group of our United Methodist churches, has been doing some work in this area, but I know that they're going to want to participate in this challenge, opportunity, however you want to frame it.
We met, as a matter of fact, that group met this past week, and we talked about this in our comprehensive plan as we journey forward. And we're aware of the funds that came into the community. And I had a gentleman to approach me about those monies, but I have not heard back from them. The director of co-op just lost her daughter to drugs 3 months ago. And so we have a lot of need and issues here, but we want to get on top of it and do something.
And can you say a word, Kenneth, about sorry for my ignorance, tell me a little bit about the Native American co-op.
It houses 11 Native American United Methodist churches. And one of those churches has an AA program that meets weekly. Okay. And we're trying to expand it into other churches as well. And there's about 55,000 Lumbee Native Americans in and around our community. And it is a pandemic of drug problems here. And so I don't know how to get wired or connected with the folks that got those monies. And we've been very concerned, as Jay alluded just a moment ago, but we're needing some help in this area.
Well, we're happy to help. I know Elizabeth, again, can maybe help quarterback that, but if we can help. One thing I want to mention, and please forgive my ignorance on this, but there is a separate settlement with the same defendants. That is the 3 drug distributors plus Johnson & Johnson. There is a separate settlement with the federally recognized Native American tribes. That is additional funding specific to those tribes. And that was just announced last week. And I just, forgive me, but don't really know the mechanics. First of all, I don't know. I mean, it's confusing because it's certain specifically recognized tribes, but that might be something worth looking into as well. I mean, the federally recognized tribes had their own counsel. It was not Attorney General Josh Stein that represented them. They were separately represented, but that's probably, Kenneth, something worth at least understanding the lay of the land as far as whether, the extent to which that settlement might provide a separate funding stream. And I just don't know the details.
That's part of the problem, is that the Lumbee are not federally recognized.
Okay,
recognized.
Yeah. That's what I was sort of wondering as those words were coming out of my mouth.
Yeah. Largest tribe east of the Mississippi River, and they're not federally recognized. Promises were made.
I'm sure.
Any other questions or connections we can make?
I did just want to thank you personally, Elizabeth, and the Council of Churches and your partners in health and wellness, health and wholeness project. I think it really shows really a high level of vision and leadership to have kind of launched yourselves into this space. Of course, long before, long before the opioid settlement stuff came along. But I know that Chris and Elizabeth and I have been on so many phone calls with so many different partners, the Harm Reduction Coalition and others. And I'm just really, really grateful for your leadership in this space.
Thank you. I really appreciate that. And all credit cannot go to us, because really we've just been listening to the churches and what y'all have been leading us to. So really appreciate that.
Hello, my name is Christy Banks. I am question for you. I am the Health and Wellness Minister at St. Mark AME in Rocky Mount. I have a question. We have an NNA group that meet at our church, and I would just like to know, will there be many grants offered? Because we were awarded the mini grant for partnering with Health and Wholeness, because this is awesome. My background is substance abuse as well.
That's a great question. And just let me say, so Rocky Mount, am I correct that y'all are part in Nash and part in Edgecombe? Is that right? Or am I wrong on that? Forgive my geography lesson question.
It's interesting. It's Edgecombe, Nash, and Wilson counties.
Okay. So a couple things. The first thing to say is that each of those counties, of course, you're in that weird space in Rocky Mount of being part of 3 different counties. One thing to keep in mind is it's going to be up to each of those counties to decide how they're going to, which strategies they're going to fund and how they're going to do that. I'm trying to remember if Rocky Mount, do you happen to know, Amy, if Rocky Mount is is Rocky Mount in the 17 municipalities? I'm thinking not.
I
But
don't think so, but
I don't think
I'm
so.
trying to
Okay.
pull that up as we speak.
Yeah,
so I
it's
will
on the
check
more powerful.
while
We
we're
link to it
talking.
on more powerful.
Mhm.
So Christy, you're going to need to reach out to, potentially 3 different counties to see how they're going to, to advise them and advocate, but ultimately see how they're going to use the opioid settlement funds. It might be worth, there's a great group that is actually based, that we've mentioned already on this call, that is actually based in Wilson, the Community Impact North Carolina. That's Anna Godwin and Aaron Day are the folks there. And so maybe again, Elizabeth, it might be helpful for us to connect Christy to Anna and Aaron as part of the follow-up.
Well, that's awesome, because I was planning on reaching out, but the support from you guys, that would be great. Thank you so much.
Thank you for that. Thank you
You're
for that
welcome.
question.
And thank you. And Steve, you're correct. Rocky Mount is not one of the municipalities that will receive direct funding, but they will be in that
Those 3 counties.
multitude of counties. Right.
Yep. Thank
Christy,
you for
just
that.
oh, sorry, Steve.
No, go ahead.
Just to tell you, as far as Partners in Health and Wholeness, there are grants available and for any issues around health and wholeness of your community and your faith community. So definitely reach out to us. We also, and I'm trying to see if my colleague Jessica is still on here. We have been awarded a new grant opportunity that will be going to BIPOC-led communities and faith communities to address the mental health concerns as it relates to COVID. And we know that people who use drugs have been very negatively impacted by COVID, not being able to get to their medication assistance programs, transportation issues, just all kinds of things. So definitely reach out to Elizabeth, reach out to Jessica or myself, and we would love to talk to you about that. And just like to briefly thank Steve, thank Amy. We have been on hours and hours and hours of phone calls. And one thing that I appreciate so much, and I appreciate from our funder, who immediately plugged us in with people who use drugs and people who are impacted by the overdose crisis. And we take our direction from them on what works and what they need. And I've watched the state really respond in that way too. And we encourage faith communities to do the same. So we really appreciate you.
Thank you.
Thank you so much, because just as a sidebar, because currently what we're doing is we're making sure that everyone has the mask, and that everyone is receiving the at-home test kits as well. We're having church members to call us so that we can assist them with walking through with getting that done. I just wanted to throw that out as well, because my background is mental health also, so I will be in contact. Thank you.
Wonderful. Thank you.
Excellent.
You're welcome.
say something briefly. I work with the Partners in Health and Wholeness, but on a personal level, this weekend will be the 11th anniversary of my late husband passing away to accidental opioid overdose. And so I'm just so grateful that though it's too late for him, this is going to help so many families and members of our community. So thank you for all of this work.
Thank you for sharing that, Krista. Really, really appreciate your courage in talking about that.
Yeah, absolutely. And I don't know why, I get, every time we come on these calls, we hear these stories of it, and I don't know, I'm not surprised anymore, but I'm just so appreciative of the courage folks to share. And that, like you said, I know that there's nothing that we can do in your situation, but I just hope that some of this is going to be helpful moving forward. So thank you for sharing. We just appreciate the opportunity to be with you all today.
Well, we have more time to take questions, but if there are no more, we can also wrap up a little bit early. So just want to put that out there.
Want to put out there too, if you have someone in your community who's lost a loved one to substance use, feel free to give them my contact information. I'm happy to talk with them if they just want support from someone else who's been through it. I'll put my email in the chat.
And Krista, where are you located?
I'm in Chatham County on the Chapel Hill side. So, yeah.
Great.
Yes, that is another thing that we would highly support, would be support groups for people who have lost loved ones, grief support groups. There are a number of ways that churches can really be involved and provide a lot of help in communities.
Yeah, and Krista and Elizabeth, as a point of information, by the way, I was recently talking to Wanda Boone in Durham, who's just an incredible resource and has organized folks so well in the Durham community. But she specifically shared with me the last time I talked to her that she has three parents in her community who have reached out to her, who have lost children to specifically opioid overdoses. And so if you're ever looking for that type of connection, specifically in Durham County, Wanda would be a great resource. I just mentioned that in passing.
I will definitely keep that in mind because I'm currently working with the Durham Health and Human Services Department to put on a conference to educate faith leaders about harm reduction. So
you got it.
Keep her in mind, and we'll let the Partners in Health and Wholeness people know about that conference as well. We're not going to limit it just to people in Durham.
Yeah, and Wanda is so networked into everything in Durham around SUD and prevention. You would want her to amplify that. If you're trying to get folks involved in that effort, you definitely want to talk to Wanda.
I will. All right, everyone. You will be getting an extremely long email from me in the coming days of all the resources that we have mentioned today and a follow-up evaluation that we would love if you would take the time to fill out. It will also have a link to this recording so you can go back and watch. We just want to say thank you for spending your time with us today. We really appreciate you engaging in this issue with us.
Thanks.
Thank you so much. And we'll see you on the 24th.
Yes, please come back and talk with us more on the 24th around this. Yes.
Bye, y'all.
Thank you, y'all. If you need anything, reach out to Steve or me. We appreciate you. Thank you.
Thank you.